Hi,
Hello.
thank you so much for joining us today. Can you share with us about yourself? What is your name?
My name is Rad. I'm from Thailand, and my daughter name is Minnie, and she was diagnosed with the AADC since she was 3 months old.
When did you first notice that something was not right?
Because at that time she was 3 months, but um, I noticed of her delay development. At that time, she could not even lift her head up or um, just lay down on the bed and move a bit. And first time I noticed about the her symptom is she has OGC.
And her OGC is when her eyes roll up, right?
Yes, yes.
And how about her body, her muscle?
Um, uh her is like this,
Twisted.
and yes, like this, and her feet is moved
Yeah,
out like this. Yeah.
that's like Riley. Yeah. How did you feel at the time when you saw her eyes and her body like that?
uh that time I suspect about seizure,
Yes.
but when I took her to see the doctor, and the doctor did some checking. He said it's not seizure, but he suspect like a um, CP or other disease. No one think about AADC because it's very rare disease. But luckily at that time we met one of the genetic doctor, and she thought about the AADC. So we sent her gene for checking. I can't remember when we in America or something or
Yes.
somewhere. Yeah,
So how long did it take you to find out Minnie had AADC deficiency?
2 months after that, she was diagnosed. She first admitted to the hospital when she was 3 months old, and she was diagnosed with the AADC when she was 5 months old.
Oh, so it just took you 2 months.
Yes,
Yes,
yes.
that's very, very good. Can you let us know what your life was like before gene therapy?
It's quite difficult to taking care of her because she just lay down on the bed and always vomit, uh and she cannot she take a very long time to drink or eating, and always choking.
Thank you. That must be very hard. I remember when Riley had pneumonia every time, like when she was eating or drinking, she'd choke, and we sent her to ICU, and we stayed there every time. The one time that was really bad was she stayed in ICU for about 10 days and she almost died because
Oh.
her lung collapsed.
Yeah, yeah,
Yeah.
yeah, yeah. Minnie was the same when she was 1 year 6 months. She spent about 2 weeks in the ICU because of her lung infection as well.
And how did you know about the clinical trial?
Luckily, my genetic doctor at l-amino hospital, she told us about this.
What was the surgery like for you? How did you plan to go to Taiwan for this? How long did you stay?
Once the doctor in Taiwan accept Minnie to join the program, I mean to do the gene therapy. Uh, we first time went to Taiwan for checking and to for her blood checking and brain scanning, and then we go back and they schedule 6 months after that for the surgery.
How did you feel when they accepted you for the surgery?
Oh, I'm think like I'm won a lottery, won a big prize of lottery because she tried with the medicine for almost 2 years, but I see a little bit improvement. Yeah.
So, how was it like after gene therapy? Can you share with us how is your life different now? How is Minnie's life different after gene therapy?
Um, I would say after gene therapy, it's like she was born again, and she has gene therapy when she was 2 years 6 months, and after that, she has a I saw her development every day, even it's not uh too fast like normal children, but it's very much better than before gene therapy.
Can you share with some of the things that she can do?
Um, she started from uh, move her body, lift her head up, and learn to roll over and learn to sit down by herself, and she can hold the baby finch and stand up and uh, hold the baby finch and walk around. Um, but I would say she has a good progress until the COVID-19 crisis. So everything stopped. We stopped sending her school code, and previously we have the PT and OT come at our house to practice her every day. We stopped everything for 2 years, more than 2 years during the COVID, and just uh, resume again a couple months ago.
Yes. I saw her in Taiwan and I think she's doing wonderful.
Yeah, but um, if compared to Lyle, she's
Yeah,
she has very very good progress, and I think you guys taking care of her very very well.
yeah. I think,
Uh,
each child is different and they will go grow at their own pace. As a teacher, I never compare students. So I always think that our children grow at their own pace and their own step, and they will get there one day. It just at their own time. I would like to ask you to share any messages or words for future AADC deficiency families. Do you have anything that you want to tell them?
um, for me, I believe in the technology, and I believe in the treatment, and um, I hope everyone will live with hope, because in the future, who knows, if just be only one jab of vaccine, and our children maybe can um, can improve and taking care herself, who know.
Yes.
So just take a good care of them right now for a chance for them in the future.